right. So now we come to class about cancer. So I just have an alto voice. Okay, so just to blend with you. Okay, cancer. So it's really serious topic. But I hope that this, like 1 hour or so, I try to convey the important message for all of us here, which I think maybe like many in the world. I have gone to Sri Lanka to give lectures to the oncologists in Sri Lanka on this matter. Okay, so it's Thai style. Just to recall it, white crew. Okay, so I'm trained in cancer from Professor Alessandro Liviano. So if you search his name, he is a very great guru in cancer. So he is a kind of scientific director in East Penn. He's a very great guy. So if you search his name, you'll find a lot of subjects, a lot of published papers on cancer. Okay, so he's a very nice guy. And the thing that I will convey to you, the message, is simplified, but it emerged from research. I conducted research in cancer, diet and cancer, in a series of research. Okay, and this is the one that I want to thank many people, my students, okay, and the daycare center in chemotherapy center in Chulalongkorn Hospital, and a lot of people, a lot of nurses involved in these studies. And these studies, the CAN project in King Chulalongkorn Memorial Hospital, consists of a lot of aspects, from the assessment of whether they have malnutrition or not, the prevalence of malnutrition in hospital, the multiple sensory aversions, or there are changes in sensory sensations in the mouth, so that it affects the cancer patients. So we have to know that. Okay, the food acceptance, the menu development, and the food belief pattern. Okay, and this is a kind of paper that I have published in the assessment tool in cancer patients. It is the work with the doctor in Chulalongkorn Hospital. She is resident in medicine, and this is the multiple aversions on food sensation, the taste and smell in cancer patients receiving chemotherapy and Dr. Nurin Warawut will be here, I think next week, right? Ajahn Mano, yes, you will see him, and please just say hi. Long time no see, Dr. Nurin, but we work together. Okay, so this is the kind of work, and it came into the pink sheet poster, and it is presented in Las Vegas in the Aspen, the conference of the American Society for Enteral Nutrition in Las Vegas in 2010. And there are a lot of people interested in my pink sheet here, because normally they have very white sheet, blue sheet, but Ajahn Jongjit has a very, and people say, oh, you pink sheet? Okay, yes, okay. And there are Ajinomoto, who is, okay, very interesting, and follow me onto Thailand, who wants to see what is the sensation in the mouth that is changing in the cancer patient. And this is the food acceptance paper in Gothenburg, in Eastern meeting in Sweden. So here it's like this in Gothenburg, and this is the menu development, because we have in the end, finally we have to come up with the real menu whatsoever we do research. So we have cooking, and this is at Chulalongkorn Hospital. We do real tests and do research in what is the patient's feel about the menu that we do. So finally, 2 months back, I did the book. Okay, it is the pocket book for the patients, which I try to, my 5 years involved in with cancer patients in Chulalongkorn Hospital, I want to come up with a simple book to help the patients. Right now we are, correcting the manuscript, but it will look like very, the menu, the knowledge of this kind of menu, which is in the book. It is the book, the menu for Northeast, for the North, for the South, for Chinese menu, for vegetarian menu. So we try to accommodate all kind of walks of life. Okay, this is the North. I'm sorry, it is in Thai, but we'll just only Chinese food, vegetarian food. And last year, I go to in Bali, in Indonesia. I go to present the paper on the food belief pattern, which I will share with you. I think it is very interesting and very nice to know so that we will understand more the patients. Okay, so this is the food belief pattern that I go to present there because I won the first prize in Thailand, and it is my duty as a representation from Thailand to present in the Asian stage. And then I have won the second prize, second winner in that conference about this paper that I'm going to share with you. Okay, so first I would like to say that I talk a lot to doctors who deal with the patients because Thai doctors, I don't know, do you experience the same thing? But Thai doctors, they may think they know everything. Okay. Sorry, Dr. Mano. He's my friend. So, and doctor will have very, very, very short time talking with the patients. 2 minutes, 3 minutes, and do you know what is the thing that the doctors say to the patients about the food? Yes, they say, eat more, eat everything. 6 syllables. Eat more, eat everything. Just that. In Thai, กินเยอะๆ กินได้ทุกอย่าง Okay, so it's 7 words. In Thai, just that. They don't elaborate. They don't, explain. But in the patient perspective, is that satisfied? กินเยอะๆ กินแล้วเป็นมะเร็ง It will make, it will produce cancer, or it will, result in more cancer. Why do you say to me like this? So the patient is confused and getting back and seek other options. That is the thing that happened. Okay, so this is the paper just to prove or to kind of evidence that there are some people, some researchers are interested in these. How well do doctors know their patients? And it is the factors affecting physician understanding of the patient's belief. Do you know what the patients believe? Okay, so we think they think like us because we think that no concern about food. Okay, things like that. So do we know what the patient thinks? We ask doctors, and also we ask nurse, and also we ask a caretaker. Do you know what the patient believes? And when you give suggestion, it will, kind of like tune in. This is the paper. So it's kind of like very scientific, but, just only to see that there are smart guys who can do research, who can measure belief Oh, it's very, very, very difficult because belief is what? Can you touch it? Belief? No, it is the way people think and behave, but they can by the methodology. And if you see the A model is what the physician think, the B model is the physician believe that the patient believe. And the third one, the C model, is the real patient belief. And when you look at the difference from B to C, the p-value is extremely different. Okay? If you know how to read this, the number, the lesser the number, it means totally different, extremely different. So it means that there are some people who do research on this and prove that what the physician or the doctor believe that the patient believe is different from the real thing that the patient really believe. So this is I think it is an important message. And when we answer the patients. Do we really answer? Say, eat more, don't ask, eat more, eat everything, stop. Okay? So it's kind of like, I don't want to deal with this. No sense, why ask this? Okay? So I think there are papers that address communications. If you want to help the patients, you need to understand the patient. So communication is very, very important. Communications between physicians and cancer patients about these. One, we call it CAM, C-A-M, CAM. CAM is complementary and alternative medicine. The pills, the kind of detox, the kind of colon cleansing. It is specialized diet. So the Gerson, if someone will have ever heard about Gerson diet. So these alternative ways of dealing with cancer when people want to stay away from chemotherapy, okay? So when communication is not good, the patient will not, getting better. So this is just only the example of what is really the patient kind of like it flow from the patients. They say, I always ask him a lot about the vitamins. So today, if you have questions about taking some vitamins, please feel free to ask about vitamins. But he is not a big believer in vitamins. Both of them and oncologists. So they are not big believers. They said the attitude was, you are wasting your money. But here, if you want to take it, go ahead. So it's in what emotion or what is it? If someone or the doctor that you just rely on him and said, take it, go ahead. So it's kind of don't care, right? So if at this moment, what is the patient feel? So they feel that he and the doctor is very far away, right? They are far away. They don't communicate. They don't explain why I don't believe in vitamins and so on. So another is when I did go to my oncologist, I told him this was what I was doing. He just laughed. Like when you said you take some kind of herbs, very weird names, okay? And he's just laughed. So it means that, what are you doing? See, like this. So he said, you got to be kidding. Are you eating or you take this kind of herbs every day instead of receiving chemotherapy? So he thinks it is foolish. This is what the patients say, feel that doctors think I am foolish. Okay? So I don't like his attitude. So it's very sensitive, right? So to talk with the patients who has the last chance to survive, right? They have the last chance to survive and they eat everything people advise, okay? And there are a lot of advice. So they eat this, eat that, eat those, everything. So they practice weird things that you cannot accept. But I think first we need understanding, okay? This is the one, and sometimes doctors come with the numbers, a lot of statistics. This is so complicated, I cannot, if it is like farmers or they don't understand what you're talking. And so they tell you your longevity versus your mortality rate, how many days you will survive more if you take this chemotherapy and that. So, maybe sometimes complicated. So, because some doctors believe in it and some doctors don't, and I didn't know what he felt about it, so I just never say anything. So it means that communication shut down, right? Because patient will kind of like reserve himself a little bit because cannot show what you think, what you eat, what a weird thing it happens, because don't know which doctors will accept your practice or not. So it kind of like it happens like this, communication is not good, and in the end we don't know why chemotherapy is quite serious. If you take this and that, it may bar or have effects on the treatment itself. Okay, so I just show you the environment or the atmosphere that we have in Chulalongkorn Hospital. I may have experience just only in the very big hospital, but there are lots of people, and every time that we open the table, there are a lot of people or patients coming in like fish spa, fish spa. The fish come like this, and every time we open the table, there are a lot, and they just write down. They're just very curious to know about a lot of things. They have tons of questions. Okay, for the cancer patients, they are so detailed. Sometimes they consume a crocodile's blood. Crocodile's blood is common in Chulalongkorn Hospital. Okay, it comes in tablet, capsule. It comes in kind of liquid in small bottle like this, because I ever opened such bottles. Okay, once one patient, she is the daughter of the patient. Okay. And she said that, Ajahn, I got this one. It is someone sell me this one just today, okay? And the seller said it is the crocodile's blood, fresh, and you do not keep it in the refrigerator. You have used only in 1 month. So this is the first day that I got it. So I opened and dropped that crocodile's blood here. It is the instinct of pharmacist. The instinct. It is like feces. I want to die that moment, because I think, why do I use my own hand? Oh my God! It is very stinky. And I said to that lady that, do you know, just feel it. And you drop these 10 drops for your mother every day. You let your mom eat this. And at this point, she is very weak. She is receiving chemotherapy every day. Her the white cell count is very low. And you just give this. It is like serum. And it's like overnight serum, or smells like this. So, and if you keep it for 1 month, you eat it in 1 month, oh, terrible. So because they keep it in a very small bottle like eye drop bottle. They just seal it. You don't see everything. It is the white bottle, opaque. You don't see anything inside and it is very sealed. So every time you open and you drop 10 drops in orange juice, and you don't know because it is like dispersed in your orange juice, so you don't know the smell or everything bad. In fact, it is very, very rotten, very bad smell, okay? So this is what I experienced myself here in Chulalongkorn Hospital. There are a lot of examples. So those patients have a lot of questions. So we will conclude, or we will summarize that cancer patients, they really desperately need the right information because they are given or they are exposed with a lot of information. They want the info that they can trust, okay? Because that is their life. You have to be responsible for your suggestions. They need the guiding lights. I think this is in times of trouble, okay? And there are more paper, like this is the paper from Global Cancer Control. So they emphasize that understanding and influencing cancer-related belief, it will improve the outcome. So if you understand, really understand the patients, and you just, help them, explain to them until. So the thing that I'm saying is really difficult. But I trained the students to be patient to the patient. To be patient to the patients. And it's quite, a work. And then we have to, showing respect and compassion for such decision. Otherwise, it will discourage patients from disclosing, right? Everything that they are using, coffee cleansing, things like that. So they put the coffee in the anus, and that is the thing that you will never think it will happen. So right now, I will try to share with you what happened or what the patient thinks first. The cancer patients are strange patients, not like diabetic, not like cardiovascular patients, not like hypertensive patients. They change their diet strongly, around 70 to 80%. They change. When you say to them, they change. And they change more. For example, eat vegetables. They eat only vegetables. They don't eat other things. Vegetables from morning till night. Vegetable juice. Things like that, really. So, if you have to be careful about what you suggest or your advice, because they will do more. Unlike diabetic patient, you said, oh please, reduce this and that, and diabetic patients will, okay, and then go back. No, don't do anything. But cancer patients, you have to change the paradigm. You will have to anticipate that. They will really lovely obey everything, even more. So please be, slow. Be slow. Otherwise, they will try their best in the world to seek that kind of herbs that you advise, something like that, okay? So please, the patients will change very easily and strongly. And male patients, there is gender difference in thinking. Male patients, very concerned about food safety. And they asked me, Ajahn, fish, they put formalin in the fish. and I can't eat, I don't want to eat. So when we say about vegetables, they will say they have chemicals. So in the end, don't eat anything because of fear. And they are really concerned, strongly concerned. So if you cannot clear. So if you are concerned with the fish, you must have the good source to buy. The trusted source. Don't say, I don't eat because I'm afraid of the toxin something. Please be active to find the right thing to eat. Okay, so we must have the answer to kind of calm down or to relieve them from fear of toxins. They have very concern. So, and this is also in the Middle East, the same thing. They published the paper that male patients have more concern about food safety than female patients. So that's strange. Okay. Second, there is the belief, attitude about good food and bad food exists. They will say, if there is no bad food, why do I get cancer? I think that I get cancer because I eat bad things. This is the mentality. So if this is the belief or the mentality that the cause that I come to this point is that I eat wrong things. There are evil food. I have to stay away from evil food. So they will identify some food, whatever the source is, the source of information is. So they will tendency to believe. And you will, I think mostly the cancer patient are, what the bad food they think? Do you know? Beef, yes. Any other?
Sugar sauce.
Pardon? Oh, fish sauce, okay. Other? Pardon? Ham, okay. That is a processed meat, okay. Is there any other? So it's a meat in general, meat, animal protein, okay. So that is, almost for my experience, almost 80% or 90%, unless those patients who, the doctor has said that you can eat that, okay, and some patient is easy to be reversed, and then they just eat. But mostly, they are afraid of animal meat, they abstain, stop eating. And when the cancer patients stop eating, they really stop. And they just, no, serious, not like us, okay, 1, 2, okay, not serious, but for them, serious, totally not, okay. So this is their belief. But the doctor said, eat everything. So when the doctor said that it has effect, okay? So look at education, and it applies to all of you here in this room. The higher education, the more harmful belief, right? I don't know if you accept that or not. Why it is like this, I won't discuss, okay? But it is the research result. The higher the education, the more harmful belief we found. Next, gender difference. It is very funny. Male patients will seek their spouse's advice. Why the female say no? Okay? So if you find, or if you deal with male patients about food, you will address their spouse. Say to the wife, okay, you talk to him, yes, this and that, and he will believe her. But if it is the her who is the patient, and you address the him, her husband, the effect, the influence is less. She will believe her friend more than her husband. Okay, this is in the things in the family. But it is strange, but it is like that. Okay, there are gender difference in believing in your own, own spouse. Okay, so this is the way that it will help you to address some key persons to have influence on the patients. Okay, and I will skip this. So this slide is the result that I think it makes me have won the second prize. I do qualitative research parallel with the quantitative research. The QN is quantitative, the QL is qualitative. It means that what we found when we asked the patients and the questionnaire, what do you believe? 1, 2, 3, 4, they tick, tick, tick. Is at least, this is the interview, talk. What do you think? What do you really think? 1 hour, 2 hour discussion. So, the quantitative says that the information source that the patients mostly trusted is health personnel, doctors, nurses, the first, 75%. So they said, I trust doctors. When we talk, they say, advice, nutrition advice that the doctors and the nurses gave is not clear. Is not clear. And doctors just say, eat everything. Eat more. This advice is conflicting. This is the wording that the patients say. It's not me. It's not from me. It's from the patients. She says that, or they say that, this kind of advice is conflicting with what the patient think and feel, because they think cancer is the most disastrous disease. Then some food must be the cause. Doctors' advice to eat everything cannot be true. This is the main factors making patients confused, and then they divert to other sources. So at first, they try to trust, to anchor their life with the doctors. But after they found that the doctors is questionable, trust goes away. Okay, so this is the mechanism that we try to elaborate from parallel on the same patients. One, when they fill the questionnaire, they say that I believe doctor, but in the real life, they say it is not clear. Something like this. So it is like in-depth, deep in the mind. So that's what we call in-depth interviews. We have to, talk until the truth emerge. Okay, this is the way. So I'm sorry, this is the pathway. Just leave it. Okay, and professions. The professions do matters, and I think those who are in this room, the research results say, for those professions like lecturers, teachers, okay, health, personals, or those who are dealing with kind of using, skills, I don't know how to say, but arts, those, or accountancy, these kind of jobs, or the practice that they deal with is the indicator of concern, of fear, of what will I will confront with, or I will meet next after first diagnosis. So this is the thing that those with this kind of professions will be more concerned. Because when I ask farmers about, are you worried about this? They said, oh, no, it's okay, day by day. But for us, oh no, we think about the last day of our life, and then we just like, we call it จิตตกนะ จิตตก okay, our heart sink to the bottom, like this. Okay, so this will affect our eating, right? So we don't have the mood to eat, apart from the chemotherapy, apart from every drug that we have, and then we have the kind of like adverse effects, and then our own thinking, we are very worried. Okay, so I will come to the next about specific type of food. So some patients deny to eat particular food, okay? Especially what we found most is animal, okay? Animal, meat, sugar. So, and patients believe that some food are harmful and some are good, okay? So this is the research. Beef is the most rejected food in cancer patients. Beef, and then what? Fermented products, grilled food, raw food, pork, high-fat food, things like that. So we are lucky that fish is quite okay. It's in this part, in this zone, okay? So subject believe that not only beef, but so this is the questionnaire. But when we ask, it's not just beef. In the questionnaire, we got only beef. But in the interview, we know that, they don't eat, they have a lot of fear. And that is because all animal protein, meat and poultry, as well as cow milk, is the cause of cancer. So if the thing is like that, can we kind of motivate them to eat? Only that we can, we can say, or we can explain to them until they are clear that it is not. Do you think it is easy? Not easy, really? Pardon? Yes.
Did they have this belief before being diagnosed, or did this belief occur after being diagnosed?
Okay, thank you so much. It's after. It's after, because our questionnaire has differentiate between what you believe before getting diagnosis and after. So this is after diagnosis. And I think you can kind of anticipate or think that there are phenomenon. When one person get cancer, friends, families, relatives, neighbors, everything, okay. So they are, with a lot of advice. So at that moment, and also they seek their own information in the internet. So internet is the kind of like wide open source of information. So many information will, come. Okay. So all these factors will, aggravate the severe malnutrition in cancer patients. And sometimes I might say that the patients starve to death. I have seen those cases. There are one patient that I know 2 years ago. It is before New Year. And I think that I will deal with this problem after New Year. And when after New Year I came back, no more. It's gone. He said, I don't eat food that it is not hot. And in the ward, in the patient ward, no hot food. It is Chulalongkorn Hospital. You know, from the kitchen to the patient, an hour. So food is cold, and he has no relatives to take care, all alone, and nurse will not be available. Nurse in the, you know, it is a common ward. So after New Year, I go back and ask the nurse, and nurse says, Ajahn, in this New Year, we have only 2 persons in charge, you know, because every person go to holidays, and you know, it is very few personnel available, and I can't, you know, service him with making the food hot and then give him to them. So he refused to eat food, refused until death. That happens. So it is kind of strange things, but you will know that this kind of belief, very strong. We will think that, oh, is it possible? But it is. Okay, so apart from meat, there are others. There are soy, there are cow milk that people question. There are dietary supplements that people take it a lot, and there are a lot of belief about that. Okay, I think I will leave some time for questions. Okay, so another thing about female, as different from male patients, is that female patients has a tendency to believe in juice, in plant juice. So in the chemotherapy ward, I found that there are baskets. They produce RC water with, and then chemotherapy, and then this kind of juice. So the female patients have the tendency to, you know, believe in vegetable juice. So in fact, you know, they drink all the day, and their stomach is full of vegetable juice, and they can have the room for food. Okay, so this is the thing that happen, and in the end, it will harm their treatment, their cause of disease. So to conclude with the research results, I may say that the major food belief in cancer patients are: stop eating animal food, animal protein source, and they drink a lot of vegetable juice in bulk, in many liters a day, and high dose vitamin supplement, very high dose. I found those who take 16,000 milligrams of vitamin C a day. It means 16 tablets. You can see tablets of vitamin C, 1,000 milligrams, 16 tablets a day, 4 tablets a time, 4 times a day. This is our patients. Okay, so this is the high dose vitamin supplement, mainly vitamin C and beta carotene. This is the top, okay, popular, hoping that cure cancer, hoping that food belief pattern reveal the changed source of information from doctors or nurses to alternative medicine and the patient verification of the device by their own try and error. Okay, this is the way that the patient do, and it is sadly that there are opportunity lost. We have, you know, experience or meet the patients who have very sad story about roaming from this alternative to that until the tumor get this big. And you know, what is the chance of treatment? Even though at that point you are accepting chemotherapy, this big tumor, what do you expect? So this kind is what we call opportunity lost. So the time, the early receiving treatment is kind of critical. Okay, so opportunity lost of and the loss of patient's trust should be considered, and more understanding in patient's thinking. So this is the other loss of trust. Because when the doctor said, okay, eat everything, don't ask, okay, that will drive the patients away. Some of the patients' belief is harmful to health, while in fact they want better health. For example, protein avoidance. That will worsen malnutrition, low white blood cell count, and the beta-carotene supplementation. The last sentence I would like to emphasize. Beta-carotene supplementation will increase lung cancer. At least because I think that right now there are 4 cancers that beta-carotene can, have effect. Skin cancer, gastric cancer, lung cancer, and lastly, it is genital urinary tract. Okay, so many different types of cancer can happen with supplementing beta-carotene. So I beg you, apart from all kinds of chemicals or what to name it, but please, for beta-carotene, right now it is clear that we do not recommend at all. Okay, so I get from the patients verbatim, word by word from the patient. Doctor told me I can eat everything. If not, I will not be strong enough to hold on against the disease. I eat vegetables, all kinds, except bamboo shoot. Eat poultry, pork, but poultry, pork, and milk are the food my daughter forbid me to take because they stimulate cancer growth. This is from the patients. So it means that the member in the family with a lot of love and seriousness, my daughter forbid me to take. I found many families like this. I am doing what we call family counseling. In that, I said, please bring everyone to the chair, to the table. We talk to the wife of the patient, daughters, sons, everybody at the same time. Because the daughter said to me that, Ajahn, my brother is the big ass. I don't know. He is serious. He forced father to this and that, not to eat this, not to eat that. So I said, yes, bring him in. Otherwise, you cannot solve the problem. So the therapy come to all the family in terms of cancer, which is different from other disease, right? We have to find who is the big problem in that case. In this case, it is my daughter. Okay? So you have to see that the patients, cancer patients, are confused. Okay? Because there are bombards of information, of suggestion, everything. Hey, come to this. Hey, come to that. I heard there are a lot of good, remedies for cancer. No need to do cancer therapy. No need to do radiotherapy. No need. And this is the thing that you will receive. And then the next one. I will advise all of you here to use one of the best tool I ever find. Okay, and this is in my book. We call it WCRF table. You can download free in the internet. I will show you. So because we wonder if doctor said eat everything and the internet said it will produce cancer, which one is correct? Right? Why I am talking about this issue? Because everywhere, radiologists, the Association of Thai Radiologists in Thailand has invited me to talk this session, and the doctor, is it real? What are you talking? So it's amazing. Even though the radiologists or the doctors or the oncologists, the medicine, everything, they just wow. So the task is the patients need to be empowered by the strong knowledge and the true knowledge. This is what my aim is. Okay. So the question, which information is correct? I bring you to, this is the World Cancer Research Fund 2007 report, which is called the second report, the green one, the green cover report. Okay, it will release the third report, I think in maybe 2 years' time. Okay, so right now it is 2007 second report, but in that website there are a lot of information. Okay, first I want you to know that the World Cancer Research Fund is the kind of NGO that is non-profit organization, and they try to, our vision is to help people make choices that reduce their chances of developing cancer. That is their aim. And they know that the answer is not easily yet. So there are a lot of people. I will show you here. Okay. So we were the first cancer charity organization to create awareness to the blah blah blah. A lot of things you can read in their report. But I just want to show you about the expert who involves. It's not Jongjit. I can't do this job. It is tons of experts. Okay, and it is a big group like him, Junchi Chen. I met him 3 times. Okay, in different WHO meetings. So here, Dr. Philip James. Okay, Pijin, you know him. He came to Thailand many times. He is a very, scholar, I must say. I heard his lectures were very, very good, very knowledgeable person I ever heard. So it is Philip James, Alan Jackson, blah blah blah. A lot of people, and they are keen with the data. And here they are keen with nutrition and obesity and the cancer prevention, things like this. Very good. Here. So in this, like who've met? I met Ricardo Wawe. He came to Thailand many times. I sit beside him. Okay? So these guys are really, really great guys in the world. So it's not Jongjit. I cannot do this job. Okay? It's a lot like Steven Seisel. He is the one who, 34 years back, when I just first started loving nutrition, I read vitamins. My master thesis is on vitamins. So I read a lot about vitamins. And everybody who reads vitamins textbook must know Steven Seisel. So he is very, very, very great gurus. All these people. Okay, this is the website. The website is like this, and there are people who gather and they divide the job into many different aspects. They have the station in UK, in Hong Kong, in Netherlands, like this. They are WCRF International doing the job. They have a lot of jobs here. They have UK station, Washington DC, they have Amsterdam, they have Hong Kong base. A lot of job divided. And if you go to the resource downloads here in the homepage of the website, you can download free resource. So if you open on this, you got a lot of things, and it is, first hand for you. Okay, if you go, that there are blue one, a green one like this, the second report, and a lot of things to show. This is the whole book. You can get it, and then I show you that. Even though people will say that the second report is quite long time, it is like 7 years back. But the job that they are doing is a very, very great task. It takes a lot, quite like 10 years before one great volume of report is summarized on every kind of cancer. So the suggestion or the knowledge is specific for each type of cancer. Very great. Like if you want to see about colon cancer, if you want to see about breast cancer or lung cancer, it is kind of specific. Okay? So this is the update book. So you can also download the update book after the more information update after the second report is here. 2010 breast cancer report. There are the summary, and colorectal cancer, pancreatic cancer, endometrial cancer. So this is 2013, and I think 14, 15, 16, there are, coming up. Okay, so answering about updating. So what I am talking to you right now, I bring from these kind of updates. I think I'm concerned with update because I will try to, giving the most updated knowledge for the patients. So there are blocks. The color of the box is, showing the kind of high risk or good or bad. The bad is in the red zone. The good is in the blue zone. White is neutral. Okay? If you see the box that is blue, it means very good. Protect against cancer. So if you know how to read it, it will show you everything. Here is the table that you will find from the download. The table is these columns. The most left column will be different kinds of foods. You will see each one. Very amazing. You will see each kind of food and each type of cancer in column. Okay? So this is the cancer of mouth, the cancer of nasopharynx, esophagus here, lung, stomach, pancreas, liver, breast cancer, things like that. Because it is long, I can't. So you can look at the cross point, the junction. For example, if you want to know about lung cancer, you will see in the kind of this one, and if there are blue box, it means that there are some specific type of foods that is protective against. And what is that? It is vegetables, it is fruits. Fruits. Okay? But be careful. It is not the fruit that we think in Thailand. Because otherwise you will come back with durian. Or, it is not a sweet type of fruit that they mention. They will mention apple, pears, peach, or those with, not sweet, not very sweet, It's not like lamyai or our rambutan or very sweet fruit like what we have in Thailand. So please be careful about fruits. But it is okay, guava that we have this lunch. Okay, so fruits is very good and protective against lung cancer. There is evidence, very, very good evidence. Okay, and then food containing carotenoids here. What is that? What is food containing carotenoids? Carrot, right? For example, because kind of like green leafy vegetables also containing carotenoids, because green, orange kind of vegetables, they have the carotenoids. So food containing carotenoids, they are blue box. But looking down here, beta carotene is red, bright red. It means highest risk. So you see that these kind of table, they separate foods that is high in beta carotene and the beta carotene in the capsule. These two things are different. Please be knowledgeable about that. Please, differentiate between those in the food. For example, vitamin E in the food and vitamin E capsules. That is different. So it is very strange that food containing carotenoids protects against lung cancer, while beta carotene aggravates lung cancer. We have many examples, sad examples. So I want to say to you, this is evidence. So please don't make mistakes about this, okay? So this is the example of how to use, because I think you will have a lot of questions, but you can use this to answer your questions. So if any kind of type of cancer, they have like red box, blue box, red box, blue box. It means a lot of box. It means that food has, is a factor contributing to having that cancer. But I think in some cancer, they are blank. They don't have anything. So please know that, for example, breast cancer, it is empty, almost empty. It means that it doesn't involve food, but it involves with obesity, not specific type of food, okay? So you can differentiate between the effect of specific type of food and obesity as a whole, okay? In terms of breast cancer, I think next week, Dr. Narin, he is big guy on this. You can ask him everything, but I want to say that for some ladies, for some patients who I've met, she said that I'm very sad. I have been taking care of my health very, very good, and still I got breast cancer. So right now I will eat everything. This is the thing she said to me. So I will say that, yes, okay. But please look at the evidence. You presume that because you eat healthy food and still you have breast cancer, so you think that next to this point you will eat everything. I will say that if you eat bad, you may get cancer earlier than this, who knows. So don't step into the wrong directions. if you know that the food is less, influence in terms of breast cancer, you just take care of the food for the sake of the health overall, okay? Not to combat with breast cancer, but to give you overall health. The objective will be like that, okay? So if you say that, I take care of my food, but still I have recurrence of breast cancer, it is different things, okay? So don't be losing heart by you are doing good, right? And then you said, so right now I eat everything. Don't do that, okay? So if you understand this kind of table, you will know that for some specific type of cancer, for example, colon cancer, you have a lot of box. You have blue, you have red, blue, red, because our colon has influence from food directly. Okay, so if you behave, you may stay away from colon cancer. Okay, so this lunch, do you take all the vegetables? Okay, so I hope that you enjoy using this table from now on. Okay, I will show you that. Okay, this is our students, very proud of. For her, she now graduated from Australia, master, and will become our lecturer. So here, I say that every time we open the table, there are a lot of patients wanting to know. Okay, so this you look at the patient. She behaves like a reporter, so she notes everything we talk. Okay, because she wants to know what to eat. So this and that. Okay. So this is the thing that happens, and we know that the patient is hungry for right information. Okay, so this is, okay. So, and when we talk about specific things like alcohol, yes, alcohol will increase cancer of, the esophagus and breast cancer. So this is the fact. And when we look at specific type of food, with blue. So fruit is one of that. But like I said, don't leave the room with more durian or okay. But fruits have a blue protective, but you have portion. Okay, 3 portions of fruit a day. Perfect. Okay. And you see, there are blue in the fiber thing, vegetables thing, like this, food containing folate, food containing carotenoids. So they have, addressed in very detail. I think it serves our thirst to know. But in this slide, I just want to show you about salt. So salt is red in only one column. So there are friends from Japan. Japan has a very high incidence of stomach cancer. And you need to know that the Japanese food is quite salty in terms of everything. Everything's like miso soup, okay? Even the soup, even the, grilled salmon or any kind of fish, that is very salty. So it comes with the kind of stomach cancer. So salty food, not only about blood pressure, it contributes or it has effects on cancer. Okay, so this is the atmosphere. This lady, she has 5 cancers in her own body. Liver cancer, breast cancer, a lot. Okay, he has a lot of cancer. And these two persons, guess who is the patient who got cancer? These two. Left or right? This one? This one. Left or right? Left, right. Who is right? That's right. Who is left? Okay. At first, because I try to to be like surveyor. And first I let the students talk. And then I said, I think this one is the patient. But in the end, it is this one. She's very good BMI, 20 through something. But this one is a friend. In the end, we consult the friend. Because for her, the patient, she is very good. Right now, she behaves very good. She eats very healthy. But her friend, okay, with a BMI of 30 something. So it's very funny. But I teach the students to, please be aware of everything. Like, they bring friends. Talk to their friends. Oh, because don't just be very narrow. And then patient sit this, you just focus on patient. Focus on her friends and help her friends. Okay, so in all, the knowledge that we give to the patients has to be updated. I stress on that, update, specific, credible. This is my philosophy of, dealing with these kind of patients. Some of my patients is a PhD. Okay, so they have master, even sometimes it's medical doctors. A lot of, very educated. So we're talking red meat. Do you think red meat increase cancer? Who think that red meat increase cancer? Okay, a lot. Okay, so red meat, there are a lot of papers reporting that red meat will increase cancer. I know, and I think you have come across with those kind of research results. But right now, I want to elaborate a little bit that some research is not detailed enough on that. Not every red meat create or increase the risk of cancer. But there are detailed studies to reveal that the cause of cancer they come from the process. The process is high heat, high temperature cooking, like grilled or toast. So if you grilled, you toast, you use high temperature like over 200 degrees Celsius. Like when you grill, it is 270 degrees Celsius. That creates the one type of chemicals we call heterocyclic amines. We call it for short HCA. HCA is heterocyclic amines. This kind of chemicals is carcinogenic, or it increases cancers. So if we eat a lot of steak, we are exposed to, or we have higher risk of getting cancer. Okay, so not overeat the red meat or the processed meat like the sausages or those kind of products. So it is not the meat itself, but the fat part that will increase the risk of cancer. Why I am saying this? Because when the patients are under treatment with chemotherapy, the red blood cell concentration, we call it hemoglobin, of the patients normally falling down. And in that situation, if you don't eat red meat, it is very hard to get the hemoglobin up. Okay? So if you can eat some, not much, for example, 2 to 3 spoonfuls a meal, just only 2 to 3 spoons, tablespoons, okay? 2 to 3 tablespoons a meal. That is enough to help increase hemoglobin, and it will help the patients from anemia, the situation in the hemoglobin, and also it's about the white blood cell counts that will go very low when patients get chemotherapy. So I will have to convince the patients, and many patients have gone through chemotherapy very well, looking like us, and then get the chemotherapy and go to work every day, not very fatigued, not very tired. They can finish the course of chemotherapy very well. So if because of many, there are many factors that will affect eating of the patients, their own, everything, and if on top of that it is the belief, and then they just said, I can eat it, I do not vomit, but I choose not to eat. So if you choose not to eat, it even, worsen the condition. Okay, so this is quite important. So I have a lot of experience on that in the patients, and in the end, when we can convince, we can explain, we open the table to the patients, we give that, and then we just show that you check or you prove on your own. I give you 2 weeks. You just eat animal meat for only 2 weeks, low-fat animal meat, not like,ขาหมู or, okay, lean meat. And then you come back and check your hemoglobin level, if it is better. So you prove for yourself. That is the way that during chemotherapy, it is a very critical time. But if you stop this, that, and you don't eat many things, it will, make your way on the chemotherapy or radiotherapy tour is bad, and you may be having to stop, prematurely. Okay, so this is what I have tell the patient. So this is one of the example of the study. If you find the study with the name EPIC study, EPIC, it is the very, very, top study that you will trust those kind of results. So the EPIC study is European. 27 countries cooperate, and then they have result that, the meat, the eggs, dairy products, and the risk of breast cancer. So we know that these meat, eggs, dairy products, and having no, not increase the risk of breast cancer, so that the patient will, with their relax and can eat without fear. Okay, so this is what we want. Okay, and this is the kind of more evidence that it is the very, very well done meat that, produce high carcinogens or, the cancer producing agents. Here, this is the one of the example. Okay, and so they have a lot of paper. This is fish. So fish will, reduce the risk of cancer. So we encourage patients to eat fish. Okay. So I want to skip this and just only show the hate of my friend. When you have chemotherapy, you know that many patients try to avoid because of the side effects. But I let you see that hair loss is the one that we cannot avoid. It will happen. No one can stop hair loss. But you will see that after hair loss, this is after she is my friend, okay? So this is the new hair that growing out, very nice, okay? So this is my friend who has breast cancer, okay? And is a singer. This is, we are in the church, okay? And this is the, okay? And the side effects, I think, and in the mouth, when they got chemotherapy, they have kind of inflammation in the mouth, but if you can eat enough, this kind of inflammation will, kind of like subside, or you can fight with eating enough protein. But in the case that they stop, they avoid, there are, very red inside because the tissue in the lower part cannot grow to kind of cover the outer part that is, shredding away. Okay, so it kind of like we try to combat, or we try to compete with the thing that is going away by eating so that we grow from the inside. Okay, because I have the experience with the patients who have radiotherapy, and then with the radiotherapy they are very red here, red, and it's like blood here. But when we advise and we give more food, this is, going away. It turns black, and in the end go away. It's like fresh skin. We can see that in our own eye with the food that we, manage. So it is the way that if we leave the patients eating like very badly, or stop eating this and that, it will harm the patients. Okay, so that is what I want to see. Okay, okay. The I let you see this girl. Yes, and we see that we have like this wood chair, and it's very painful. When she got cancer, she is, weight loss, and then she had to knitting the kind of cushion. Okay, so when she gone, I just take I just take photo on this. So it means that she lose a lot of weight until when she sit on things like this, it hurts. So she has to knit or to make this special for her. Everywhere she sits, she got to have this cushion. So weight loss appear, but we have to combat to fight this, and she survived. Right now she's very happy. That is 3 years back. Right now she is very healthy. Okay, so I will go to these foods. So come to food. This morning I say to you that, we are very lucky. Thai food is very, easy to, you can manage your weight. But in terms of cancer, it is not. Like this, som tam, right? Lap, right? What? Gang Leung, right? It is the soup in the south, which is extremely spicy. I can't eat it. Okay? So this is Thai food. Very hot and spicy. Oh, it's very, very, Okay, nam prik num. Okay, it's kind of chili mix. Okay, and what? Sai ua, right? Okay, gang som, right? So it's a special soup, but very sour and a little bit like spicy. So if you look at the patients and say, what kind of food we will, give to the patients, because mostly when you go to order food in a simple food shops, if you order like mixed vegetables, fried something, or you will get those mixed vegetables with chili, right? So you have to order no chili, okay? Because this chili will harm the mouth of the patient. So please be aware of this, okay? Aware of this, okay? So because these patients have food aversion. So if the hot and spicy, you said, it's not very spicy, but for them, they cannot tolerate. So please, kind of like, be careful. I asked one patient, I said, คุณป้า why do you don't touch? Because the cover of the tray is not even open. Why? She said, อาจารย์ even though they said food without chili, but I think it is chili, kind of like taken chili out. But when they cook, they put chili. But when they, scoop or this patient, they just take chili away, but chili is still there. It's like som tam, when you say one chili or no chili, but if you are not, you cannot tolerate, you say ล้างครก like you have to change the mortar, and you have to clean the mortar because the chili that remains in the mortar is bad. Okay, so that is the thing that we try to convince you that we have to be kind of sensitive on the kind of food aversions that happens, not only hot and spicy, but even sweet or sour. We've heard from the patients that when I taste the food, when I get the chemotherapy, at this part it is bitter. At this side it is salty. I just looked at. Why do you put a lot of like salt or a fish sauce? But the cook said no. I just don't. Please be careful that sometimes they feel over. And it is not their fault, it is real. It is real for them that it is too salty to bear. So please understand that in the patients receiving chemotherapy, sometimes they have reactions that you think that, they are kind of like a bossy or what. So you said that, I can't accommodate for your this kind of sensations, but it is real. So please know that when I do the research, I know that for some patients, they are sensitive and please put it down. And for some patients, they want it more. You don't know who is who. You have to ask. There are both increased and decreased sensation in whether sweet, sour, bitter, or salty. We cannot predict. Okay? There are no kind of like specific pattern. Okay? Sorry. So it is the taste change. I'm sorry. This is the taste change. Overall, the taste change is like 80% change. So they are not like want to make you fussy. They are real. Okay? It is 80% change in taste. Okay? And the change is also bitter, sweet, sour, salty at the same proportion, but the hot and spicy taste is changed 50%. So it means that mostly the patients cannot bear. Or there are some, I think it's kind of 3 to 5% of the patients want more chili. Because no taste at all, I want more. So that happens, okay? Okay, and other than taste aversions that happens, they also have constipation, they have mouth inflammation, they have taste loss, diarrhea, swallowing difficulties, smell loss. These happens. So you know that in the patients there are many types of problems. So please be, empathic, have sympathy on the patients because a lot of problems occur. So cooking for these kind of patients is not easy. You will, quarrel about cooking. Okay? So hot and spicy is a big problem. And what to avoid? We avoid hot and spicy, avoid fatty food, avoid roasted and grilled, bitter food. And if you want to increase sourness, like lemon is very good. The patients love lime. And in Thai food, it is good. And the patient said, oh, lime make us like feeling better. Not like awkward or, nausea, something. Help relieve nausea. This is lime. Sour taste, okay? But if you want to increase, by care, because sour is acid. And if they have mouth inflammation, it will hurt. So if you want to increase, smaller, okay? And herbs is very good for them, like galangal or ginger. A lot of herbs help the patients. So it's the food that is acceptable. Okay? And the size of food should be small. Because of the teeth, and somebody used the kind of fake teeth, false teeth. And they have to put away false teeth, otherwise it hurts or it irritates. So they will have like very chewing problem. So please do it in small portions. Okay? Small, size cut, soft, easy to swallow, like more liquidy, more moist and watery, and thickened food will help swallowing problem. So this is the thing that we can say, and this is the real thing. Okay, this is the thing that we offer to the patients. Each milk, Northeast. Okay, and this is the day that we taste the food. Okay, and we often find love story. Because he is police, and the wife, she said, I will wake up at 4, cooking for my husband before I leave to work. So we find a lot of love stories. So I said, oh please, let me take your photo for life. I will, let you inspire others. She is very lovely. Okay. And so nutrition counseling will have the, very good effect, or it is very important to counseling to just understand, and then in the end we know what food is really, answer them. Okay, and I think this is my last slide. In the end, she's the one who I'm seeing. Kun Pa, why do you don't touch even the cover? And she said that, okay, look at her. She has no teeth. Okay, so the food that offered to her have to be chopped. I have to ask, chopped food, no chili. And she said that, Ajahn, really no chili, but still hot. I have to go to the kitchen, please. You separate this for her, please. Have to, do it, this kind of like vegetables, fry or anything separately, okay? So in the end, on the day that she will leave, she stay in Chulalongkorn Hospital for 2 months, and then she is getting better, and then she she write the notes. She waits to give the notes for me, which I don't know. I just walk like this today. I walk a lot. So she said that, thank you, Ajahn, that you come by often to help with the food, the health, and have nice words for us. Thank you.